Come in.
Hello, Mr. McDermott.
Hi.
Hi, thank you for seeing me on such short notice. My name is Moreno Sanjo, and I am going to conduct a short interview for my health and policy class.
Nice to meet you, Maureen.
Thank you. All right. The bill that the HR 3832 is the bill that you introduced to help support the Affordable Care Act. Is that right?
Mm-hmm.
Okay, and you have previously supported the Affordable Health Care Act, and currently there's a lot of controversy about the quality of care and how to stop Medicare fraud.
Mm-hmm.
What impact do you think the Affordable Care Act will have on both patients and providers if some of the goals are to reduce wasteful usage and of government healthcare resources?
Yeah, so hopefully the Affordable Care Act will cut down on fraud by increasing transparency and letting everybody know where Medicare money is going and how providers get reimbursed and how insurance companies reimburse those providers.
Okay. And what educational or support groups can be implemented to allow the consumers make the right decisions on what health insurance coverage they need to obtain?
Yeah, so I think the rollout of the Affordable Care website was done poorly, but it's actually a good resource for consumers to find out how to get the care they need and how whether they're eligible to sign up, whether they can get subsidies for their health care, and ultimately obtain health care from the website.
Okay. And is there a plan to prevent insurance premiums from increasing?
So right now, enrollment targets are, since we insure everybody as part of the Affordable Care Act, even the sickest, we need healthy young people to enroll as well to offset the cost of taking care of people who are sicker and older. And so the plan is to get as many people enrolled in plans that are younger, healthier, to offset those who are older and need the care maybe more. So that's the plan, to keep prices low at this point.
Okay. And how does Medicare plan to reward healthcare providers who provide quality care, and how will quality care be measured considering the new guidelines?
Yeah, so there's two ways that that people can be rewarded. Basically, there are affordable care organizations, which bundle providers together and measure their goals based on the population they serve. If they go under those goals, then they get rewarded, and if they go over the goals of the resources they have, then they get penalized. The other way is through hospitals. Hospitals have certain safety and other disease endpoints that are monitored, and those that meet the goals get rewarded again, and those who don't meet the goals set forth by the ACA get penalized.
Okay. And what measures can be implemented to prevent the public from viewing the Affordable Healthcare Reform Bill as a socialist act whereby the government wants to take over controlling people's healthcare issues?
Yeah, so that's a tough question. The basically education about where our healthcare has come from, that it's a mixed system compared to more socialist systems like Canada as a national service. So I think education that of where our insurance come from, it's a private mix. The marketplace that's been created by the Affordable Care Act is actually completely private insurance companies. The public part comes from subsidies provided by government for people to afford insurance. So I think if people, the bill is very long, so it's very hard to read the whole thing, but if people became more educated on the key points in the bill, then I think they would understand the bill a little bit better and understand that it's actually a move away from socialists. The bill could have been much more geared towards government intervention in healthcare.
Okay. Well, I want to thank you for your time, and we will be speaking further on this bill. Thank you so much.
Thank you. Nice to meet you.
Thanks.
All right.